Hello, I'm Dr. Deborah Bravoy with Anchored Hope Counseling. Welcome to our YouTube program, Hope Talks. We have some great content provided by our amazing counselors, and we hope that you find it helpful.
Greetings, folks. Back with another episode of Hope Talks, here with Brad Walker. He's our addiction specialist here at Anchored Hope. Just have a few questions for him, and wanted you guys to get an opportunity to meet Brad and just learn a little bit more about addictions. So Brad, how long have you actually been an addictions counselor or therapist?
Been working in the field of substance abuse since 2007, so 12, 13 years. 12,
13 years. Tell us a little bit about some of the things that you've encountered and what you may see in terms of change recently over the last several years.
Changes as far as treatment and substances and that kind of thing go, the move in the last few years, I guess, to like your vape stuff, a lot of synthetic type of substances back a few years ago, the K2 thing.
Absolutely.
Other than that, everything's pretty much as it's always been. There may be, a few new things here and there, but it stays pretty generic in nature, I guess.
Absolutely. So one of the things that's, sort of happening in terms of society, recently in society, is, the opioid crisis. Mm-hmm. And so over the last, maybe the last 4 or 5 years, we had this rise in usage of opioids and addictions. Right. In terms of opioids. How has that sort of changed any treatment modalities, or have you guys been sort of overran with this?
I think there's a lot more focus on opioid than there used to be. I don't know personally where I land on that. I mean, everything else is just as critical as as the opioid crisis is. So I certainly think that we see a lot more probably overprescribing of opioids, and I think we as a society have become much more aware of how critical that is, because there certainly is a need for pain medication to help people Absolutely. Manage their condition, but I think we've become much more aware of how that can turn into an addictive type situation. So
yeah, absolutely. So for our viewers, can you just give them maybe a basic rundown of how addictions counseling, if you will, is probably different than most other regular forms of counseling?
I think addictions counseling, in particular substance abuse stuff, is very misunderstood. The theory generally that I find is, we've got a loved one with an addiction issue. If there is a decision to send them off to treatment, it's like, hey, let's go, let's send dad or uncle or cousin or mom or whoever off to treatment, and they're going to go do 30 days, and then they're going to come back home and everything's going to be fine. And it just doesn't work that way. It's a lot more complicated process, and it saddens me that when it comes to addiction that we don't see a more systemic approach to where the entire family gets involved in treatment, because I think it is a systems issue. It's not Absolutely. An individual issue.
Absolutely.
And we may have an individual using alcohol or drugs or whatever, but that's just the tip of the iceberg, as they say. There's so much under the surface that we're not touching when we take that individual approach. And so a lot of misunderstanding of 30 days and it's all fixed.
Right,
and,
exactly.
That kind of thing. And I think it's a much more lengthy process when you figure that the relapse rate on drug and alcohol issues is around 40 to 60%.
Interesting.
A month's worth of time doesn't seem to be quite enough. And so I think there's a lot of misinformation out there in our society about what drug and alcohol treatment looks like.
Yeah, that's unfortunate. But we got a gentleman here who can sort of clear that up for us, right? Okay, so tell me a little bit more about, of course, when you say systems, as a licensed therapist and trained therapist, I know a little bit of course, what that means.
Right.
Why don't you tell, our viewership sort of what, when we say system, an entire system, what exactly does that look like for people watching?
Well, like for example, in addiction treatment, again, in particular substance abuse, as I said, we typically tend to focus on the individual that's doing the using. And the systems approach would say, okay, it's not just about dad or Uncle Billy or whatever. We're going to get mom, dad, the kiddos, grandma, grandpa, aunts, uncles. The more people we can get involved in the treatment process, so that we get everybody on board and a buy-in into realizing that we're all a part of that picture, then the more successful treatment
Better
becomes.
chance of success, absolutely.
When we just treat that one piece of that system, it's kind of like treating the flu with just a cough drop. It's okay. It does make a little bit of difference,
right.
but it's not really taking the whole issue into consideration. So,
Absolutely.
the more people we can get involved, then the more successful we become outcome-wise.
Absolutely. So, what type of advice would you have for someone who is, since we're discussing systems, for someone who is dealing with, a spouse, a child, a family member, or a friend who has addictions issues?
First thing I would say is maybe spend a little time doing some research, and behind that I would probably have to offer be kind. So often what you encounter is that people say, well, you go do whatever it is you need to do and we'll be here when you get back, but you go take care of your problem. And I think there's a misunderstanding that approach is like a kind of a tough love situation. And I think sometimes it's not really a question of tough love, it's that the other people don't really want to be as invested in the treatment process, and they think it's just this individual. And so I think so many people with drug and alcohol issues are misunderstood. Again, we're back to misunderstanding. I think that a lot of times our society believes that those people are drinking or using or whatever it is they're doing based on a choice. I want to do this. And it's been my experience that is far from the truth. Most of the time, these people, by the time they make it to somebody like us, they have maybe tried various different things to get themselves out of trouble or to quit drinking or using. And they're just at an absolute loss. And the last thing they want to do is to hurt or do damage to their family and their loved ones, but they just don't know how. And so from a family standpoint, to just be kind of screaming at that individual, you go do your thing, right. Kind of lives them on an island a little bit, and they don't feel supported, and that's a big part of the struggle, I think, with overcoming that.
Absolutely. So you just mentioned sort of them being left on an island and left alone. I just learned something myself just listening to you in terms of the approach that other people should take, be a little bit more involved, a little bit more patient, or what have you. Can you speak a little bit more towards what somebody should, if there's key words, say for instance, patience,
right.
Things of that nature, is there something in terms of a key word? Because I know I tend to work best when there's just one or two different things that I'm hearing,
right.
As opposed to trying to remember, an entire, in terms of how I should help someone who's dealing with addictions.
Well, yeah, patience is certainly one, and I don't think we can leave out the idea of boundaries either.
Okay.
The loved ones, you can still love an individual with a substance abuse issue, but set firm boundaries. We'll do this, but we won't go here. That kind of thing. And so, again, we tend to take this tough love approach rather than a boundary approach, which is a much more healthy stance.
Two different things.
Exactly.
Okay.
Exactly. And again, I think it goes back to just kind of the misunderstanding of the way that we should handle that. And so many people fall into that trap of, okay, well, I know we got to tough love them, and
Absolutely.
and I'm certainly not saying that just loving somebody is enough to help them get clean and sober.
Right.
But support is certainly a much needed aspect.
That's a
of
wonderful
that.
word, absolutely. Yeah.
Absolutely.
So one of the things I also heard you say was by the time these individuals get to somebody such as yourself, an addictions counselor, oftentimes you hear cliche terms. One of the terms that you oftentimes hear is they have to hit rock bottom. Some people have to hit rock bottom.
Yeah.
Can you speak a little bit more to that?
Oh, rock bottom.
Yeah.
I think rock bottom's a very misunderstood term. Rock bottom is different for all of us, you know, and the circumstances that it takes for a given individual to finally have a desire for abstinence or recovery or whatever, they're not all the same. You know, for some people, they might get a DWI, and that might be enough for them to say, you know what, I don't want to do this. I don't want it to get it any worse, so I'm done. You know, and then for another individual who really has no intention of being addicted, but they find themselves, they just keep falling further and further down that hole. You know, God only knows what rock bottom's going to look for them. So it's almost like it's almost like sometimes when we get caught up in that trap of rock bottom, like we're shoving them in the hole. You know, and maybe we can be a part of seeing that elevator go down only a certain amount of floors rather than all the way to the basement.
Yeah, I see. I understand.
But it's certainly, again, it's a misunderstood term, I think, and different for every one of us.
Right.
So.
Now in terms of the support that, you know, people who are dealing with, others who have addiction issues can provide, maybe at a later point in time we'll do another video in which Brad can sort of mention some of those resources. You said do some research. Yeah. And so maybe at another point in time so we can kind of prep people for things of that nature. One more question for you.
Absolutely.
Are you seeing anything new in terms of addictions? We were just having a video, we just did a video before in which we were talking about internet addictions and social media and things of that nature. Are you beginning to see anything differently that's not quite mainstreamed, if you will, in terms of addictions and substances?
I think we as a society are beginning to change our view of what addiction means. And while we've been talking mostly here this morning about drug and alcohol addiction, I think we are becoming more aware that addiction is not just substance abuse.
Absolutely.
And addiction is crossing over in a lot of new areas, and which is a battle in and of itself, because so many people think that addiction only pertains to drugs and alcohol, and does not pertain to gambling, or does not pertain to sex, or does not pertain to, you know, cell phones, internet, all those things can very much be not only just as addictive as drugs and alcohol, but the behavior is exactly the same. So there's no difference in, you know, the characteristics of addiction with alcohol as there is with the characteristics of addiction with internet gaming. I mean, they're exactly the same set of criteria. So
interesting.
Yeah.
Okay. Well, maybe at a later date we'll get an opportunity to talk a little bit more about that. But thank you guys for viewing.
Thank you for watching Hope Talks. We hope this information was beneficial for you. Please be sure to check out our other videos, and if you would please like the video and subscribe to our YouTube channel, we would really appreciate it. Thanks so much and have a blessed day.